Hi everyone, it's Tammy. I just wanted to briefly talk about change and how, but I don't necessarily mean change in a very big way. It's more about changing the way we think and the way we operate in life. I feel really compelled to talk about this today because I was sitting in a commons area when someone came up and started talking about breast cancer awareness. Now we are on day 29 of October, and October is known as breast cancer awareness month. Yet I feel like it's time to stop talking about awareness. It's time to start talking about various health conditions. I think we're all aware that there's breast cancer. I think we're all aware that there is autism. Two very important aspects to health in my arena. At the same time, so is addiction. But we don't see anything going on around addiction awareness. I have a great propensity to assist those recovering from addiction, but it starts with changing the way we as a society views mental wellness, the spectrum that mental wellness rests upon, as well, which includes addiction. And so when I heard these people requesting money for breast cancer awareness, I thought it was time to actually speak out and maybe talk about change awareness. It's time that we're aware that we need to change. Gandhi said, "Be the change you wish to see." And, we keep wanting other people to change, but we're not willing to change ourselves. I was in a dialogue just a few minutes ago. People think it's very difficult to change from addiction, change your behavior from an addictive behavior into one that's healthier. But I'm going to go out on a limb and say, if we don't change the way we think about things and the way we see the world, it's virtually impossible to get somebody to really change the way they think and see the world. Yeah, we might be able to break the habit of, smoking a cigarette or, drinking alcohol, or, there's also the gambling addictions, there's shopping addictions. At the same time, though, once we eliminate that, we find that we still have that addictive nature. And therefore, like I say, really changing the way we see one another and think about one another is what I want to facilitate in this conversation. Are we addicted to stress? Are we addicted to thinking negatively? Are we addicted to I'm going to stop it negatively because I was going to say seeing people in a poor light, judging. Are we addicted to judgment? That's a different way of saying it. So being able to identify these things within ourselves is really what's going to turn the world around and make a difference in other people's lives. When we stop allowing ourselves to be limited by circumstances and recognizing how difficult it is, how many of us actually white knuckle life. I know for a fact how that feels, when you're raising children and you're so worried about what could happen and all the what ifs and the shoulds and the shouldn'ts. And being able to relinquish this tight grip will actually end a lot of stigma that's going on in the world. A lot of people won't stand up for themselves. They won't seek the help that they deserve because of what other people will think and say about them and how they'll be viewed. It's relentless, this fear. And we talk about loving people unconditionally and accepting people unconditionally, and yet so many people live with fear. And being, again, really changing the way we contextualize our life in this world. I started off talking about addiction, and in this particular one, I really want to focus on addiction because a question that got brought to my attention earlier today is in Santa Fe, the job market is thin. There's a lot of drug use in this town. Her experience was, no matter what, regardless of where you are, there are people using. I have to ask the question, what the heck are they doing when it comes to being drug tested? I'm thinking the drug testing in Santa Fe is pretty minimal. But nonetheless, her thing was, as a counselor, how do I help people find jobs? Because financial need, when there's scarcity and our living conditions are minimal, people have a tendency, we categorize and say, well, people have a tendency to use and drink and use drugs more frequently. Well, I'm saying that it's in all job markets. It doesn't make any difference where you are. It doesn't make any difference what your job is. The possibility for addiction is there. I've worked in treatment facilities. I learned about addictions that I didn't even know existed while I was there. And so to say I can't live in a particular city because too many people are using and it's substances, and I'm seeing this fly, so you see my eyes batting around, it's because I'm watching this bug. And so what I proposed to her was actually changing the way she sees the city. Because the more she reframes the way she's looking at things, the more powerful she's going to be as a counselor to actually help someone reframe the way they see the city. It's not like any of us have to run. I mean, let's face it, addiction is about running and hiding a lot of times. Sometimes it has to do with needing to feel, other times it has to do with needing to be numb. So the circumstances behind addiction vary between people. Nonetheless, you have to be willing to expand yourself and reframe the way you see the world and think in order to be a powerful stand for somebody else and actually help affect the change in their life. People come to us all the time, whether it be family or friends, whether we are in the helping position, and that could be a medical doctor, psychologist, nurse, dentist, medical assistant, dental assistant, office manager. It doesn't make any difference. You could be human resources, you could be an employer. All of us are in a position of helping people because they come to us and they say, with their complaint or their concern, and as human beings, we're here to help. We're here to connect. We're not here to judge and limit people and label them as less than just because we don't think. So someone once said to me, in order to help addiction, you need to have had your own addiction. Well, I disagree with that. I think all we're talking about is making a change. That's all we're talking about. It's about distinguishing the motivation, the compelling why for instituting something that's bigger than where they were. Keep in mind, addiction, no matter what kind of addiction, keeps you limited. If you're addicted to being quiet, if you're addicted to stress, it keeps you limited in what you can move forward with. So my encouragement to her was to actually begin expanding the way she sees things and create a shift within herself so that at that point she can, affect change. Not because she's had a history of addiction or has witnessed addiction, but simply because she knows what it means and what it takes to facilitate change, to reclaim her own power in that regard and facilitate a change in her life. Because at that point, then she's going to feel more powerful and she's going to be clear. She won't be stuck on, we can't do this, this is impossible. Possibility exists everywhere. It's all in a matter of how we look at it. Possibility exists with addiction. You don't have to be afraid and that life is going to end. Life is just going to end as you know it. anyone watching this is dealing with an addiction, it's not going to continue on as you know it. People are going to fall away. People are going to show up. It's really about, are you willing to accept the changes? And what would those changes actually mean for you? What makes your change meaningful? As helpers, what makes the change meaningful in us? I mean, why would it benefit you to stop looking at people as autistic or addicts or schizophrenic? We're really holding people back. I personally know someone who was diagnosed with schizophrenia, and he works in two different parts of the globe. Okay, he's raising his own family. He works within hospital settings. He's a therapist in two different hospitals, two different continents, and when he was so reluctant to tell me that this was his situation, and when I learned that, I nearly cried because I thought it was the most powerful position he could be in, because he didn't allow the labels. And mind you, his background, his history is horrific. He didn't have a very peaceful entry into the adult life. His childhood was rampant with the stigma and the reasons why people run when they are so afraid of getting a diagnosis. I see people all the time struggling with their own mental health, mental wellness concerns. I don't like to call it mental health because we have physical health, we have mental health. I like to call it wellness because wellness is very individual. It is on a spectrum, and our mental wellness is just as important as our physical wellness. And so many people will stop themselves from seeking the assistance they need because of the judgment. They won't speak up. And the same especially goes for addiction. Is addiction harmful? Well, of course it is. But there again, like I say, a lot of people will eliminate the substance and what we consider as a culture as harmful behaviors. So that would be eating disorders, that would be gambling, that would be sexual addiction, obviously spending, shopping addiction. So these are things that are harmful in some ways, in many ways, actually in all ways, and yet we'll stop that. But there's something called a transference, and so I see people transferring that addiction onto other things. They're addicted to being a victim. They're addicted to like I said, stress and being that last minute, 11th hour, the 11th hour winner, pulling it out. They're what we call adrenaline junkies. This can also be in a transfer of an addiction. So even though someone's no longer using or practicing harmful behaviors, they are potentially transferring that addiction onto other things, which is just as harmful, but more on an internal level, and it's affecting us on a global level. And so I went to label myself as a catalyst for change. I consider myself a change agent, and that's why I come here today to talk about this, so that we can actually begin individually being the change that we wish to see in the world. But by realizing how habitual the things that we say, the faces that we make, there's a balance to everything. I was again in a conversation earlier today about the use of I'm sorry. In some schools of thought, taking responsibility for your role in how something goes by apologizing. Well, I'm sorry for how I called this in, or how I'm sorry for how I, factored into this, is one thing. But to apologize for your very existence by, reaching out to someone and then all of a sudden going, I'm sorry. A lot of people I've witnessed after that discussion today apologizing for who they are, and that can become addictive if you're not aware of how spontaneous, how automatic that reaction is just to come out of your mouth. So recognizing that, because that disempowerment, that self-disempowerment affects the way you interact with the world. And if we're here, and from what I can tell, a lot of us want to see the world different. We want to give our children and our grandchildren a bigger, better, safer world. And the only way that's going to happen is to actually change the way we interact with the world. It sounds minimal, but the way we interact with the world will therein begin to change how that little dynamic right there will begin to facilitate change in the other individual, and then it creates that ripple effect, and before you know it, there's the 100th monkey, right? You've got people doing it on a global scale. I've been called an idealist. I don't, whatever the names are, it's, well, really, I would challenge you to look within yourself as to what would prompt you to say that. And my heart just started racing when I said that. So that's where I'm going to end it for now. If I come up with more ideas on how to expound on the idea of change within us so that we can, number one, affect our own personal lives, affect the lives of those around us, improve our healthcare system, which includes mental wellness as well as physical wellness, be able to make a great impact on those living with addiction, wanting to change away from that addiction and doing it in a more meaningful manner. And then from there, however, you see the rest of the world. So with that said, have a beautiful afternoon. Comment below. Ask me questions, contact me, let me know how I can better answer any questions that may have come up for you around this that I didn't get to here, and if there's something additional that you'd like to know about. Until then, have a beautiful afternoon, and I will speak with you soon. Bye-bye now.